the reason why you probably don't understand your plan is because somebody probably didn't educate you the right way. Hello everyone. Welcome back to the Medicare Space channel. My name is Victoria Cabrera, Medicare Insurance Agent, bringing you the latest information or tips, education about Medicare, things that you need to know to make sure that if you're dealing with some of these issues, we can help you solve those issues and just to provide you some education. Today, I wanted to talk about a topic that I get a lot from potential customers that are meeting with me and new customers. As I always ask them, the first question I ask them is, one, if they have insurance, and two, do they understand what they have? Do they know what they have? And a lot of the times people do know what they have, but the majority of the time you'll be surprised that there's a lot of people, I'll ask them that one question and they're like, oh, I don't know. Well, let me see. I think I have my card in my wallet. I don't know who I have. I think it's this or that. Okay. If that's you, it probably isn't your fault. Okay. If you don't understand your insurance. And I'll tell you why. Because what happens is when you first turn 65 or you're enrolling into Medicare, you get so many phone calls out there. You're getting calls from over the phone. You're getting emails. You're getting text messages. You're getting all kinds of messages, right? Seeing commercials. Maybe you called in an 800 number and they enrolled you over the phone, which is fine. But the reason why you probably don't understand your plan is because somebody probably didn't educate you the right way. So the first thing that needs to happen to understand what you have, to really understand what you have and how your plan works, is to understand first how Medicare works. So if you don't know how Medicare works, go back to the previous videos that I've put out there on YouTube. So that way you can understand Part A and Part B and Part D and how everything works, Medicare Supplement, Medicare Advantage. So if you don't know how that works, please stop this video and go to those videos first. This video is to help you understand that it's important to understand that first before you can even understand the plan that you have. Okay? And the reason why is because if you have a Medicare Advantage plan, if you have a Medicare Supplement, you probably just have the plan because somebody enrolled you into it and you really don't understand. If you do understand, that's great. That's awesome. But there's probably some people out there that, that they're confused on how to access their benefits. How do I use my insurance? I don't know what my copay is going to be. Do I have a copay? What's the cost going to be if I'm hospitalized? If I go to the lab, if I need lab work done, what am I going to pay? And a lot of times what happens is that you get caught off guard. You go to the doctor and you say, oh, I didn't know I had to pay $50 when I came in today. I thought my agent said it was going to cost me anything. Or I didn't know I was going to have to pay this, okay? So today I'm going to teach you how you're going to access those benefits, okay? The first thing you're going to want to do is you're going to want to either, if you have an agent, call your agent today and ask them to send you a copy of your summary of benefits, okay? The summary of benefits is exactly what it is. It's a summary of your benefits. It's going to go over the most utilized services, okay? If you see a primary care doctor, if you're hospitalized, home health care, skilled nursing, lab services, radiology exams, MRI, CT scans, everything, right? And it's going to be a summary of those benefits, and it's going to tell you the service and what the cost is to you. If you don't have a Medicare Advantage plan and you have a Medicare Supplement, call your agent and ask them to send you a copy of the evidence of coverage, or send you a copy of in the Medicare New Book, there's a Medicare Supplement, a guide that says Medicare Supplement, and it goes over what Plan F covers, what Plan G covers, what Plan N covers, what Plan K, and so on. Okay, so they don't have to make it complicated. Just let them know that you want a copy of what your benefits cover. Okay. Again, in Medicare Advantage, it's a summary of benefits. In Medicare Supplement, they can send you the one-page form from Medicare and You. If you call them and they don't know what that is, then that's probably time to look for a new agent, okay? The second way is if you don't know who your agent is and you're like, oh my gosh, I don't know who my agent is. I don't know what I'm going to do. You want to pull your insurance card out, flip it over, and there's a member service number on the back. You want to call them and ask them for that information, okay? And then once you get that information, you really want to go over line by line of what your plan covers. So that way you understand what you have. It's important to understand your benefits. You won't be blindsided the next time you go to the doctor. You might have benefit, you might be pleasantly surprised. Maybe you didn't have a copay, maybe you didn't have a deductible, okay? Maybe you even had extra benefits that you didn't know about. You had dental, you have a toothache right now and you have dental embedded in your plan. Right now your vision's kind of off and all of a sudden you've been looking at the computer a lot and now you need some glasses and you have you have vision benefit in that plan. So it's very important that you understand your benefits. So one, you're not overpaying for copays. You're not waiting for care because you think you're going to have to pay a lot of money and you really didn't in the first place. You're going to have access to your benefits that you didn't know you had. If you still don't know your benefits, or let's say that you got a hold of your benefits and you're not very happy with what you see, okay? You can contact me and I can help you understand what you have, why it is they maybe put you on that plan in the first place. And if we can't make sense of it and say, well, you know, I don't know why they put you on this plan, then we can show you other plans in your area that might be more beneficial for you, that might be a better fit for you, that'll help you in the long term. Okay. Again, my name is Victoria Cabrera. If you have any questions, please don't hesitate to call me. You can email me, you can text me. Please be sure to subscribe and don't forget to watch that next video. Have a great day, guys.